Myself Satish Jindal, belongs to Ambala city. On 4th of April night, all of a sudden, I began to feel cough. खांसी मुझे आने लगी. मैंने तरह तरह की दवाइयाँ, तरह तरह के उपचार शुरू किए, बट द होल नाइट कफ कंट्रोल में नहीं आ पाई. वेरी मॉर्निंग ऑन द 5th of April, जब खांसी रुकी ही नहीं, 3-4 बजे होंगे, 5 बजे होंगे, थोड़ा मेरे को सांस चढ़ने लगा, थोड़ी बेहोशी होने लगी. तो बच्चे मुझे हॉस्पिटल ले आए. रास्ते में मेरी तबीयत और बिगड़ गई. मैं अनकॉन्शियस हो गया, जैसा कि मेरे बेटी ने और मेरे सन-इन-लॉ ने मुझे बताया. They came to me in the ICU. They said, because I was unconscious.
We had received Mr. Jindal at Artemis Hospital in a very critical state. He was unable to breathe. When we saw his lungs, the lungs were almost nearly wiped out. So what in a medical language we call as a bilateral pneumonia or ARDS. Such a patient had to be immediately taken on the ventilator at the ICU setup. Now from there on, the journey started. This patient required a lot of coordination among doctors, nurses and the entire team to make plans, change plans, improvise actions, make new decisions every point so that we are able to achieve a point. Now this patient was so sick that he was not able to be ventilated by a normal ventilator, and different strategies like prone ventilation were used to maintain his basic vitals.
There was Dr. Jeetendra, this head of the ICU department, took initiative personally himself to look after me. As they say, a lot of doctors, 10 to 15 different sections doctors came to me and look after. I remained in ICU about 15 days unconscious. They say. After 15 days, I got relief from unconsciousness to मेरे को थोड़ा थोड़ा समझ में आने लगा.
This is perfect example of coordinated and proficient team efforts by doctors, nurses, physiotherapists, pharmacists, dietitians and many more.
In between, the family members were very much disturbed. जाते थे, देख आते थे. Anyhow, after 15 days, जब मुझे थोड़ा होश आया तो मेरे हाथ बड़े फूले हुए थे. First, my wife came to me. She said कि हाथ बड़े आपके अब ठीक हो रहे हैं. I was surprised कि हाथ तो मेरे बड़े अपसेट हैं, मुड़ते ही नहीं हैं. वो उसने बोला कि डॉक्टर्स ने कहा है, डॉक्टर शिवांशु गोयल जी आपके डॉक्टर हैं, टीम के डॉक्टर हैं. ही इज़ ए वेरी सीनियर डॉक्टर इन द एरिया and the senior most doctor in this hospital is looking after, and his team is looking after you. Don't worry.
Despite all the difficulties and challenges what we faced, after a month of stay in the hospital and at least a month or two post hospitalization, today we have Mr. Satish in a happy state.
तरह तरह की मुसीबतें मुझे लड़ने में ताकत दी डॉक्टरों ने.
In his illness, management apart from medicines, the use of technology and strategy with the good decision making was key to success.
डॉक्टर्स की टीम, हॉस्पिटल्स के जो और नर्सेस थी, स्टाफ था, फ्रॉम लोअर ग्रेड टू हायर ग्रेड.
I congratulate whole Artemis team for saving such a precious life with the excellent team efforts.
I am really very thankful to Dr. Shivanshu Goyal, his team, Dr. Jeetendra, who took Dr. Shivanshu Goyal's team to cooperate me as a patient.
Thankful to Artemis Hospital.
Thankful to all the staff members of the hospital.
I would just make a small mention about his family, especially his sons. They were so supportive throughout the entire journey. They never questioned our plans. They were always supportive and they had a belief system on us. So this is what we call as a combination of science, belief of somebody, and final outcome is always in our favor.
I thanks family members for their persistence in an arduous journey from illness to recovery of Mr. Satish, which was about a month in ICU on ventilator and later on 2 months at home. I wish a healthy and active life of Mr. Satish.